Hello guys, welcome to Dr. Science. So today we are going to talk about maturity onset diabetes of the young or MODY. This is a type of monogenic diabetes which is mentioned in your internal medicine textbook, and it is divided into 1 to 7 types. As you can see here, there is a complex table here involving all the types of MODY. So MODY is a type of diabetes mellitus. Okay, as I already told in my previous videos, diabetes is divided into many types nowadays: diabetes 1, diabetes 2, ketosis prone diabetes, LADA diabetes. Okay, and finally we are here, which is MODY. So first we have to know what is MODY, and we have to differentiate it from type 1 diabetes, because I already said in the previous videos that type 1 diabetes is usually seen in the young. And as you can see here, MODY, as the name suggests, maturity onset diabetes of the young. It is also seen in young people, and so this is very important because when a patient comes, you have to differentiate between type 1 diabetes and MODY, right? So MODY is not type 1 diabetes. Okay, the clinical features here and the clinical feature here are completely different, and we will talk about the clinical features of both. Okay, first we have to know what is MODY. MODY is divided into different types. The first one is MODY 1. What is happening in MODY 1? In MODY 1, there is a defect in hepatocyte nuclear factor 4 alpha. Okay, so what is this? What is this hepatocyte nuclear 4 alpha? It is a transcription factor. These are transcription factors. What are transcription factors? If you know your biochemistry well, transcription factors are a type of keys. As you can see, this is a key here. So suppose there is DNA here. So this is your DNA, and this DNA is locked. This DNA is locked. If this DNA is locked, it cannot transcribe mRNA, and thus if there is no formation of mRNA, there is no formation of insulin or beta cells. Okay, so we need to open this lock. How can we open this lock? We can open this lock by the key, which are called as transcription factors, and one of the transcription factor was hepatocyte nuclear factor 4 alpha. So if there is no hepatocyte nuclear 4 alpha present, we cannot open this key, and there is no transcription. Okay, if there is no transcription, mRNA is not formed, right, and insulin is not formed. So these people are prone to develop MODY, which is type 1 diabetes. No, not type 1 diabetes, MODY 1. Okay, so as you can see, MODY 1, there is a defect in hepatocyte nuclear factor 4 alpha. Next we will talk about MODY 2. This is MODY 1, this is MODY 2. So what is happening in MODY 2? In MODY 2, there is a defect in glucokinase. This is very important because hepatocyte nuclear factor is a transcription factor, whereas glucokinase is an enzyme. What is this enzyme? As you already know from biochemistry, glycolysis, right? In glycolysis, the glucose, which is a 6 carbon compound, is converted into glucose 6 phosphate. Means here are the 6 carbons. On the 6th carbon, a phosphate is added, hence the name glucose 6 phosphate, and this is mediated by an enzyme called as glucokinase. So this is the glucokinase which is involved in the glycolysis pathway. As you already know, this during this ATP is produced, right, and this ATP is needed for beta cells of pancreas to release insulin, right? You can watch my previous video how insulin is getting released from the beta cells of pancreas. In that step, ATP is the major key role for the release of insulin, right? So if there is no glucokinase, obviously the insulin will not come out of the beta cells of pancreas. So in MODY2 there is a defect in glucokinase. Next we will talk about MODY3. So what is happening in MODY3? In MODY3 there is a defect in hepatocyte nuclear factor. Yes, it is not 4 alpha, it is 1 alpha. Okay, this is also a kind of transcription factor, and you know that we cannot synthesize insulin without transcription factors, right? Next we will talk about MODY4. What is MODY4? In MODY4 there is a defect in insulin promoter factor 1. So this is also a type of transcription factor which is needed for insulin production. Okay, finally we come to MODY5. In MODY5 there is a defect in hepatocyte nuclear factor 1 beta. Okay, so this is also type of transcription factor. So these are the things you should know. 1 to 5 MODYs are very important because all the questions are asked on these things. So we will talk about them once again. So we will talk about MODY1. What was the defect here? Yes, it is hepatocyte nuclear factor 4 alpha. Next we will talk about MODY2, which was, yes, it was an enzyme defect, glucokinase, and this one was enzyme defect. Okay, so in the exam if they ask which of the MODY is associated with enzyme defect, you can simply say it is MODY2. Next we will talk about MODY3. So what is the defect here? It is hepatocyte, let me change the color, it is hepatocyte nuclear factor 1 alpha, right? So this is the most common in the entire world. So MODY type 3 is the most common type of diabetes in the entire world. MODY, okay, MODY3. Next we will talk about MODY4. Among all the MODYs, which if they ask the question about among all the MODYs which is the most common one, you should put the answer MODY3. Okay, next we will talk about MODY4. What was happening in MODY4? There is a defect in, yes, insulin promoter factor 1. Okay, let me draw it clearly here. So again, finally we come to MODY5. In MODY5 there was a defect in hepatocyte nuclear factor 1 beta. Okay, 1 alpha is MODY3, 1 beta is MODY5. Okay, and this thing, it has most complications, okay, related to diabetes. As you know, diabetes is associated with many micro and macrovascular complications. So MODY5, in the exam if they ask which of the MODY is associated with most complications, you should put MODY5. So once again, this MODY2, again there is some extra information. This MODY2 here, it is most commonly seen in children, and you don't need the treatment, I mean here you don't need drugs. for the treatment. Okay, so that was the classification of Modi. There are type 6 and type 7 also, but they are beyond the scope. Okay, I don't think they will ask, but if you want to know them, you can read it from the textbook. So once again, simple. Most common Modi is type 3, Modi 3. Most common Modi in children. What is it? It is Modi 2. Modi associated with enzyme defect. Yes, it is Modi 2 again. Modi 2. What was the enzyme defect here? Glucokinase, right? And Modi associated with complications, severe complications. That is Modi 5. Okay, so these were the important things you should know to answer for your exams. Next, we will talk about what we should know about type 1 diabetes. The type 1 diabetes, it is usually seen in younger patients, because we should compare these clinical features with Modi. That's why I am giving a brief introduction of the type 1 diabetes. If you want to know more about it, you can watch my previous videos. Okay, this is commonly seen in younger patients, usually less than 20 years. This is mainly autoimmune. Okay, immune mediated. As I already told from the previous videos, one stand for immune mediated. The beta cells are attacked by the immune cells and they are completely destroyed. Okay, so that was the thing. And the thing here is, it is not associated with acanthosis nigrans. There is no association with acanthosis nigrans. What is this? As you can see from here, this is the head, this is the back of the neck of the patient. So the neck of this patient is black. Okay, it's very black, so that is called as acanthosis nigrans. And this thing, the family history is usually negative. Suppose if a single parent is having this type 1 diabetes, the son or the daughter have a risk of 5%, okay, of getting this type 1 diabetes. What if both parents are having the disease? Both parents are having type 1 diabetes. The children will be having 15% of getting the disease. Okay, so we can simply say they have a strong genetic factor. Okay, genetic factor. So next we will talk about, so these are the important things you should know about the type 1 diabetes. And not only that, these people are insulin dependent. I already said what is meant by insulin dependent in my previous videos. So what are the characteristic features of Modi? So these people, maturity onset of diabetes of young, these people, I forgot to mention one important thing. These people are also prone to ketosis. Okay, and these people are usually tall, very handsome. Okay, so in Modi also, the most important thing in Modi is that these people don't have ketosis. Okay, this is the most important thing you have to remember. These people don't have ketoacidosis like type 1 diabetes. Okay, and this is also called as ketosis negative diabetes. and these people are also young, and they are also tall and handsome. But here the main thing is the family history is very strong. Okay, family history is very strong. As you can see here, the family history is negative most of the time. The risk of association compared to 100%, it is very low here. Like 5 to 15% is very common thing, but here the family history is very strong. Like 50% of the people are getting the diabetes, I mean the Modi thing. So there is a lot of family history involved. Okay, so those are the important things. So before ending the topic, I will just show you the table which is taken from your internal medicine. So here are the different types of MODIs, as I already said. So as you can see here, the hepatocyte nuclear transcription factor 4 alpha, it is associated with MODI. The enzyme glucokinase defect, it is associated with MODI2. Hepatocyte nuclear factor 1 alpha associated with MODI3. Insulin promoter factor 1, it is associated with MODI4. And hepatocyte nuclear factor 1 beta, it is associated with MODI5. NeuroD1, it is MODI6. Actually you need not remember this, it's fine, MODI6. So that was about MODI. Thank you.